Now, at the other end, this is where we see that hook right here, which is that medial malleolus, and that tells you this is that medial side. So use that to your advantage when you're going through a tibia bone. So if we take a look at it, we have medial right here. The whole side's medial. We see our tibial tuberosity as anterior. We're looking at a right tibia bone. Moving on to the fibula, I just want to take a look again at both ends to see that they look a little bit differently. Here is one, and at the other end, it's a little sharper. So this tooth-looking side is the head of the fibula. We have the shaft of the fibula, it's just the middle portion. And then this sharper end right here is the lateral malleolus. So this feature right here, that is the lateral malleolus. Now, when you are navigating a fibula bone, what you want to do is you want to make sure the head goes up, and let's erase everything off of here. And you want the actual tip of the tooth here to go posterior, so to the back. And then the lateral malleolus, you want this smoother side. If we actually looked on the inside, there is a big divot in the bone missing called the malleolar fossa, which you don't need to know the name of that, but that structure you want to go on the inside and towards the back. And so that will help you identify a fibula bone. And so we're looking at a right fibula as well. And this is how they sit together with a little interosseous membrane between the two of them. Working on ligaments of the knee, we are going to start off with our menisci. And so what these are, they're like little rings of cartilage sitting in between the medial condyle of the femur and the medial condyle of the tibia, and also between the two lateral condyles as well. And so if we really think about it, the fibula and the tibia are what come into contact, and we probably don't want our bones just rubbing together. And so these cartilages worked almost as cushions to keep the femur from rubbing on the tibia. And they're just named after where they're located. So one on the outside is the lateral meniscus. The one on the inside is the medial meniscus. We also have two cruciate ligaments, and that word cruciate means cross, because what happens is right about in the middle of the knee, these two ligaments are going to cross one another just like the letter X. And so the one that crosses and then goes out to the front of the knee is called the anterior cruciate ligament. And the one that crosses to the backside is the posterior cruciate ligament. We also have two collateral ligaments, the lateral collateral ligament. You can also call this the fibular collateral ligament, because what it's doing is it connects from the femur to the fibula. So it'll be on the outside, the lateral collateral ligament. The medial collateral ligament is on the inside. It's also called the tibial collateral ligament because it connects the femur to the tibia. Other structures we need to understand is the quadriceps tendon. So here in a moment, we'll cover the quadriceps muscle group, and all of them are actually going to insert on the base of the patella, which is the flat portion on top, and they do it through a single large tendon called the quadriceps tendon. We also have a patellar ligament, which is going to connect from the apex of the patella, or the bottom of the point, to the tibial tuberosity of the tibia. And the action of the quadriceps is done across the patella with these structures. We'll talk about that more with the quadriceps. So as we take a look at our knee, we have the fibular collateral ligament right here on the outside, also the lateral collateral ligament. So when you're looking at a knee, you want to keep in mind where the fibula bone is. That tells you the lateral side of our knee. And then here is also that tibial tuberosity, telling you there's the front of the bone. We're looking at the front of the knee. This is the outside. This is a right knee. The one on the other side, on the inside, this is the medial collateral ligament, or the tibial collateral ligament. And we also see those menisci in between the two condyles. So the one on the inside is medial meniscus. The one on the outside is the lateral meniscus.